Kelvin.
Kelvin
Okay,
TV.
subscribe to next Kelvin TV, guys.
We love
See ya.
you.
We love you too.
Bye bye. Guys, welcome back to next Kelvin TV. On this episode, I want us to talk about something very important. I know you're a nurse, you are going to perform a whole lot of procedures, but how do you document after you are done with these procedures? It is very important and it's going to save you from a whole lot of legal issues. That's the reason why I want us to learn about how to document after a procedure. Because I'm a person and my fanboy. Yeah. So you've done the procedure, but did you document? You see, in nursing, if it's not written down, meaning it didn't happen. That's the reason why I want you to stick and stay with me for us to learn how to properly document after a procedure. You know, documentation is very important. That it's a responsibility, it's professional, and it's also legal because one, it's going to communicate the patient care. You get me? And the next one is going to also protect you legally. Then, what it's going to also do for you again is it can be used for auditing and also to write reports. So now, let's look at some of the rules and regulations on writing documentation. The first one is you need to write legibly and clearly. You know, say in our setting, in a nursing and in a hospital, no, we have computers that we use to type all those yama. But in NMC or in your nursing licensure exams or in your practical exams in your school, you are not going to use computer to type anything. That one you need to write. So that's the reason why I'm telling you, you need to write legibly and clearly so that they can see it. Then the next one is you need to use proper medical terms. You need to use proper medical terms and also avoid assumptions. Don't guess. Don't assume. Write what you did for the patient. Don't assume that, oh, my, oh, did that be? You are using your mind to write it. Then the next one is, please, you need to include time, date, then your signature. After you are done writing everything, you include the time, the date, then you also include your signature. Then the last one is you need to also make sure that you avoid cancellations. You know, so you are writing for an examiner to mark or you are writing for NMC officer to mark. So you need to make sure that you write clearly, avoid cancellation. That one is a bad practice. So now let's move to documentation. So you have a final step by step. So the step one, the first thing that you need to do is you need to start by writing according to the patient that you first attended to. The patient that you attended to, that's the patient that you need to start with. So that one, the first thing that you need to do, you need to first of all make sure you include the patient's name, the patient's age, the gender, so on, the patient name, the patient the gender, then the bed number, the ward in which the patient is met. Then you need to also include the patient's number if it is required. That one makes it very perfect. So at the end of the year, you know what you are doing. So that one is the first step. The second step is you need to include time and date. Time and date, you need to write the exact time and dates that you did that particular thing or you did that particular procedure for that particular patient. That one is the time and the date. Then the next thing is you need to also state the name of the procedure that you did for the patient. And it's okay, wound dressing and a patient now. You need to state wound dressing when I'm blood transfusion and a patient now. You need to state that you did blood transfusion for the patient in your documentation. So then the next thing is you need to also talk about why. That one is the next step. The step 4. You need to talk about why that procedure was done for the patient. I'm a patient. Why did you do that? You won't care for that particular patient. So you need to also include it, the reason why you did the wound care for the patient. You see, nurses documentation and a trouble and first one, the dean, then the name, it will start here. After we are done with this one, I'll make sure say I'll write a full documentation for all of you to know. You know a question there, you can drop it under the comment section. I'll respond to you. So the next one is assessment. So before you went to the patient to do that procedure for the patient, did you do any assessment? Did you seek for any consent? So that one, under that place, what you need to focus on, one is that you did assessment. Okay, vital signs was checked, you recorded, the patient, the level of consciousness. Did you check it? Or check it? Yeah, you need to make sure say, well, that one too, you write it. Say the patient, he was stable, he was calm, then he also tolerated whatever you did for him. So that one, and also the requirement. You get me, guys? So guys, after you are done with the assessment, we've talked about the assessment that you did for the patient, our documented, the next thing that you need to do, you need to focus on is the procedure details. How was the procedure being done for the patient? One, you will talk about the site when we procedure, and my patient, so we cannulation, I mean, say, we and then be an veins, and other IB. Okay, then you also talk about what is septic technique. So we use a septic technique and the panel and the equipment that you use for the patient. So you need to talk about all the equipment. So we use cannula and you need to talk about the details of the cannula. So we are 20 gauge, and I say 18 gauge, we use here. At the man who use catheterization. You need to talk about the catheter, the size of the catheter, we use here. All the things that you did for the patient, you need to talk about it under this place. So after you are done, the next step is you need to talk about how did the patient respond. So the patient respond. So did the patient respond to pain? Was there any pain we are able to see here? And as the patient, responded discomfort, and as was the patient comfortable? So under that place, if there wasn't any problem, there wasn't a EBR, you can write the patient, tolerated, so patient was cooperative. So and there wasn't any complications recorded, meaning say no complication, there are complaining of pain, and I say other IBR. Yes, the next one is the post-procedure care. After you've done the procedure for the patient, the care and the things that you're going to do for the patient. That one, you need to talk about. We need to talk about monitoring. Say after so what done, why man you be mutano. Yemfa condition here, and say yemfa procedure be to say blood transfusion. You see, that we are there are some patients who go on through the process now. Allergic reactions. So all of a sudden, started sweating, or started some discomfort be or their way anymore. You need to monitor. So then there are some people who are emphasizing when you fracture. So no about hospital na any POP or how feel discomfort or feel say the person can use maybe pen or something then or the rope. So no that one in a bad thing the patient is not supposed to do. So you need to educate the patient. So you need to talk about all these things. So maybe why you need to write say, okay, all these things in here was done and you educated the patient about the condition. Patient go on my name about the condition. JB cannot panic him. So why you sending money in here, you need to do this thing too for the patient. So the last one, then you move to writing the full documentation, signature, then your name. After you are done with this thing, make sure you sign your signature, then you write your name. Meaning we read documentation. So now I have a sample of documentation that I'm going to read it out. I'm projecting it on the screen. I wanted to write it, but my nyamaka. So I want us to read it together. Then the actual steps now you can say about it. Does it fall under all the steps now? You can say about it now. Then we know how you go about documentation. So now, guys, okay. So we are going to read a full documentation of a patient. I'm reading it to you so that you know how at the end of the day is a tier. So let's go. Patient KA means a patient Papa Amo. nti ne din no na mahyɛte no mayɛ ne KA. So the patient KA, a 28 years old male, was seen in the medical surgical ward on the 6th February 2026 at 10:30 a.m. for IV cannulation to administer prescribed fluids and medication. Patient was alert and oriented and cooperative. Vital signs were stable. The BP 120/70, heart rate was 78, respiratory rate was 18. Then the temperature was 36.8 degrees Celsius. The right forearm was assessed and suitable for cannulation. No sign of infection or edema. No known allergies, meaning that the patient don't have any allergies. Into first paragraph, we have medical charge on that one. No, because the medical charge when you are starting, you talk about the patient's name. Do the patient's name here, the patient KE. Then I also told you, say, when we are also here, we will talk about what the age. Age, you may say, is 28 years. Including the age, you know. Now, make a choice about World Bank medical surgical ward, and I had about time there, and also about date. Date, no, see date, 6 February 2026. Time I would buy it, 10 a.m. Procedure and the procedure was IV cannulation, IV fluids, and other medication. And I make sure say when the forearm, you make sure say the forearm is suitable for the cannulation and no sign of infection, and as only edema be there, hormone, and as any problem be there. Then no known allergy means that the patient is not allergic to BBI, allergic to anything. So we are continuing. We are continuing. Let's continue. So patient positioned supine, meaning that the patient position patients in a supine position, meaning that they are maybe patients in America. Then right forearm was cleaned with 70% alcohol. A 20 gauge IV cannula was inserted using a septic technique. Blood flashback observed. Cannula secured with tape and transparent dressing. IV line flashed with 10 ml of normal saline. Patency confirmed, no resistance or swelling. It's way no so no. My choice say you should before I may pass the cannula no. You should 70% alcohol and a cleaning the panel baby I may person me punch channel. Aside that one, me make sure you should 20 gauge IV cannula and I mean set my patient. Do one match at the plan you should hear sign here any my patient no. Maybe maybe then you should normal saline 10 ml at the flashy movers are then atom. Me check if there is a blood flashback me make sure that I want to have observed it. So now young to us patient tolerated the procedure well. No immediate complication. Site to be monitored. And patient instructed to report pain or discomfort. Vital signs to be checked every 4 hours. Procedure completed successfully. Patient stable and comfortable. Nurse Amon Aji Kelvin, registered nurse. Then number sign. Meaning say make sure say patient tolerate me procedure na me man. I talk about the patient respond. Means a patient tolerate procedure. Then make sure say the site will be monitored. Means a IV line na my man. So I need to make sure say I monitor it. Should in case a tissue and I say line here then if free man, I'll know. So then I'll make sure say I'll be checking the vital signs every 4 hours. So this is how we document. This is how documentation is being done in nursing. I love you guys. Stick and stay with Nurse Kelvin. I have more videos coming for you. Bye bye.